The TLC Wrist Splint is ergonomically designed to fit the natural shape of the wrist and forearm while increasing access and visualization for easier assessments, and is available with or without straps. We will show the application of both products. Refer to your Badge Buddy or TLC product packaging to select the correct size TLC wrist splint with straps. Each splint comes individually packaged with illustrated step-by-step instructions for your convenience. Secure the IV site according to your hospital's policies and procedures. The TLC wrist splint can be applied before or after IV insertion and can be used on either arm. Remove the TLC wrist splint from the packaging and unroll the straps. Identify the concave surface of the splint. The concave surface will make contact with the patient's skin. Turn the splint over and apply a 1/2-inch strip of clear tape to the foam on the back of the splint, on the finger's end with no strap. This will serve as anchor tape. All other tape will be applied to this strip using a tape-on-tape method. The orientation label indicates proper placement. Remove the orientation label before applying the splint. Place the splint under the patient's forearm with the heel of the hand landing in the slight bend of the device to create minor wrist flexion and provide better anatomical alignment for the IV catheter in the blood vessel in the back of the hand. This places the hand in the functional position for IV therapy infusion, which adheres to INS standards on joint stabilization. The fingers will extend over the end of the device. Secure the fingers by applying a 1/2-inch strip of tape to the anchor strip placed earlier. Wrap the tape around the fingers and back onto the anchor tape at the bottom. Fold one end under to create a tab for easy removal. The wrist and forearm straps will come pre-attached on the right side of the splint. Secure the strap at the wrist. Thread the end with Velcro into the slot and pull it through. Fold the strap around the outer edge of the splint and back onto itself. Secure with Velcro. Repeat at the forearm. Once the splint is in place, gently insert a finger under each strap to ensure it is not tight or impeding the flow of the IV fluids. If the straps obscure the catheter insertion site, consider a crisscross strap configuration instead. Thread the forearm strap through the wrist slot and the wrist strap through the forearm slot. This will allow for easy visual inspection of the IV insertion site. Check the IV insertion site hourly for redness, swelling, and tenderness. Turn the wrist to view the see-through openings. Touch, look, and compare the IV site with the opposite palm and underside of the forearm. It should feel soft, warm, and dry. Look at the site and check for signs of leaking IV fluid, and then compare the extremity to the opposite side to check for any swelling. When using the TLC wrist splint without straps, apply 3 strips of anchor tape to the foam padding on the back of the splint, one across the width of the splint at the fingers, wrist, and forearm. Do not cover the openings on the back side of the TLC splint with tape. Covering the openings will obstruct the view of the palm and forearm during assessments. Follow the TLC splint directions to align the splint on the wrist by placing the splint under the patient's forearm with the heel of the hand landing in the slight bend of the device. Secure the splint with tape. Fold one end of your tape strap under to create a tab for easy removal. Place the strip of tape across the fingers and secure at both ends to the anchor strip on the bottom of the splint. Repeat at the forearm using double-back tape to prevent epidermal stripping. A third strap may be applied at the wrist to further secure the device. Use with the IV House Ultradome or IV House Ultra Dressing to protect the catheter and loop of tubing. Replace the TLC wrist splint each time a new IV is inserted. No other armboard offers the 360-degree visibility of the IV House TLC splint. The see-through openings allow nurses to touch and compare the underside of the extremity, making it easier to avoid complications. The TLC splint ergonomically supports the forearm and makes it easy to touch, look, and compare the underside of the extremity to prevent injury. To order samples, please visit ivhouse.com today.